All right, I'll start down here. So I know when I spoke with you yesterday, you were telling me that you guys had 280 travel nurses during the last COVID surge in the winter. About how many do you have right now, and how has that been going for you guys because of the lack of travel nurses?
So we have about 150 right now. Just to compare to normal, we normally have about 40. So we still have a lot more than just kind of our typical, during our typical days. But we're up to 150 now. We have another 65 starting in the next 4 weeks. So we'll be up to 215 by the beginning of August.
What are you guys bracing yourselves for? Because it sounds like you are hiring more staff and you're making plans for something that isn't just short term.
Unfortunately, our projections are showing that we are expecting them to continue to go up, our census to continue to go up for the next couple of weeks. So right now we have 95 patients here. And to put it in perspective, we are having about 18 patients a day show up that need to be admitted. And next week it looks like we'll have about 24 patients a day showing up that need to be admitted. And 2 weeks from now it looks like we'll have about 27 patients a day showing up to be admitted. That's just at Cox. That does not include Mercy or other area hospitals.
And so you continue to transfer patients?
So right now we're keeping 61% of our patients here, and then 39% we are transferring to be admitted at another hospital. So we have been having to transfer some patients to St. Louis and Kansas City and Columbia, and it just really depends on the number of travelers we get in and what our staffing looks like. So it changes day to day how many we can keep, and just depends on what our staffing looks like.
Can you talk about the need for respiratory therapists specifically? What job do they do? Why are they so needed?
Yeah, so respiratory therapists play an incredibly important role in the care of our COVID patients, and I can let Dr. Gacy go into that a little more when he gets up here. But obviously they help manage, all of our vent patients, both invasive and non-invasive. So when we have such a high proportion of our patients needing them, they play a really important role in caring for them. It's also hard to come by respiratory therapists. In general, there's a shortage of respiratory therapists, so we have a lot of travelers posted for that as well. We have some travelers here currently, and we have more traveling RTs posted as well.
One more question for me. So early in the pandemic, hospital administrators urged local authorities to issue mandates and to take preventative measures, and they cited hospital capacity as one of the reasons for that. And I'm just wondering what's different this time around. We're not hearing as much of a push or recommendation from hospitals.
So I think right now our push is really just the vaccination. I mean, obviously masks worked when that was our best option, but right now vaccinations are our best option. And so really what the push is we need everyone, your family, your friends, everyone you know to go get vaccinated. And Dr. Gacy will go over some of those statistics, but we have some information on the percentage of our patients who are admitted currently that have been vaccinated versus those unvaccinated, and same thing with mortality. So that's our big push these days, is just go get vaccinated. It's the quickest way for us all to get back to normal, and to get hospital capacity back to where it needs to be.
Can you talk about the patients that you're seeing, most of them unvaccinated? I know some other hospitals had some statistics on that. Do you have numbers on that?
Yes, so Dr. Gacy has those numbers, so I'll let him go over that. I will mention, though, really quickly that, we are seeing a larger number of young people being admitted. So I did a quick look right before I came, and 10 of our patients right now are in their 20s and 30s out of the 95. So much higher percentage than we saw with the first wave. We also have a pediatric patient still admitted. We've had at least one pediatric patient admitted now for the last 10 days or so. So we are seeing a lot more young people getting admitted.
Could you say that number one more time, please?
So 10 out of our 95 patients currently admitted with COVID are in their 20s or 30s.
Thank you.
Right now, what's the big limiting factor? Is it staffing? Is it actual beds?
It's staffing. So like I said, we had 280 when we were at the peak in the winter, and we're able to take the 170 COVID patients. Right now, we're at the 150 traveling RN number, and it'll be up to 215 by that first week of August. So the quicker we can get more staff in, whether that's employed staff, traveling staff, the quicker we can take care of more patients.
And how's that special ward that you all built upstairs looking for COVID? Is it, since it's open,
It's full.
it's full?
Yes.
you had some issues with finding ventilators over the weekend and everything. Steve Edwards said you guys are good with PPE. Can you just go over everything but staffing? Where are we with all of that?
Yeah, so PPE, we're still doing great. We have over a year's supplies of N95s, gowns, kind of all of that PPE that is needed for COVID care. In terms of vents, we currently have 34 patients on vents. We have 82 vents in-house, so we have a lot of extra capacity right now. We spent the last 15 months acquiring extra vents for this situation, so we've acquired about 25 extra vents in the last year during the pandemic. So we have sufficient supply. We feel really good with where we are at with vents.
I know during our first wave and all of that, a lot of the patients were, if they went to Branson, they would come here. And are you seeing more people staying in these more rural hospitals than coming to this because they would eventually have to be transferred, or how does that work now?
So we have patients admitted at our other community hospitals, and obviously some of the standalone hospitals in the area also have patients. So right now, of our 95 patients admitted in the system, 81 of them are here in Springfield, and then 14 are dispersed between Branson, Monette, and Barton County. So they're still keeping some COVID patients, and then we have the majority of them here in Springfield.
Do you have any other information on how do you decide this person needs to go to St. Louis, this person needs to go to Kansas City, things like that?
So the way the transfer process works is essentially we reach out to a facility, we see if they have capacity. If they say no, they don't have capacity, we go on to the next one. So St. Luke's has taken the most of our transfers so far, but we've had some going to St. Louis and Columbia as well. We've had some going to St. Louis as well as Columbia.
Sorry if you said it already, but this 95 patients that you have now with COVID, how does that compare to the previous peak?
So our highest peak was 170 in January. I think what's different about this peak is a month ago we had 35 patients and we had 105 last week. So in less than a month we had tripled. In the winter, that took longer. It took 2.5 months for us to build up like that. So this spike has happened much quicker this time around.
Could you say and spell your last name, please?
My last name is Casad, C-A-S-A-D.
You want to swap out for Dr. Gacy now?
Dr. Gacy, Employee Health Medical Director, internal medicine physician as well, and I work with the infection prevention team here at CoxHealth.
Would you mind spelling your name, please?
Last name is Gasie,
And your first name?
Nana, N-A-N-A.
Does anyone have any questions specifically related to the variant that you want to start with?
Well, earlier, maybe in this, this wave that we're in right now, Dr. Trotman mentioned that people were waiting too long to come in. Does that still seem to be the case, or are people coming in sooner in the course of the infection?
People are still waiting longer to come in, and with this Delta variant, it's very infectious, highly transmissible, and we're encouraging the public, if you get symptoms, get tested early, come in early, and get evaluated. We have outpatient treatment with monoclonal antibodies that, if given early in the disease, can prevent getting admitted. So we encourage people to show up early and not wait till it's late.
Are you seeing varying symptoms between the Delta variant and others? I know another doctor in Webster County had said it's more, the patients he's seeing is more in the GI at first and things like that. Are there clear different symptoms with the Delta?
No any clear symptoms, but like Ashley said, we're seeing more younger people getting admitted and very sick.
How is this different? Go ahead.
Do you have the numbers for how many folks are vaccinated that are hospitalized?
So we have 95 patients in the system right now, and 99.98% are not vaccinated. So the only vaccinated patients is about 0.028%. That is why we are strongly pushing the vaccination recommendation. It is what we need right now to slow this surge.
How is this variant different than what you treated in the first wave?
So we're seeing more younger people and more sicker patients, and a higher admission rate of the variants than the prior one. Bear in mind, the prior one, there were no vaccines.
So there are 98 admitted in the CoxHealth system with COVID right now?
COVID pneumonia, yes.
COVID pneumonia. How many patients has CoxHealth admitted with suspected adverse reactions to the COVID-19 vaccine?
None.
Currently, you have no patients who are vaccinated, correct?
We have 0.02%, about 2 patients who are vaccinated with COVID pneumonia. Currently, yes. So generally, we have people who are vaccinated getting COVID, but very mild symptoms, runny nose and sore throat, but nothing that will get them admission into the ICU or in the tower. So the vaccine prevents severe disease, prevents death, and it prevents hospitalization.
With this variant, you're saying it's making people sicker. In what ways? How are these symptoms more intense or different? What are you seeing exactly?
We see more respiratory symptoms, coughing, fever, severe pneumonia, and like Ashley said, our tower is full, and all the tower patients are all unvaccinated. And we have about 10 on the ventilator right now.
So what was the capacity of the ward in the tower? I seem to remember something in 70 ballpark. Is that still accurate?
About the tower capacity.
Yes, the main unit was 53 initially, and then we've added more beds. So the big open ward is 53.
We talked a little bit about how people are waiting too long. You know, being in the part of the country that we're in, the initial symptoms of this are just about what you would get every year, right?
Right.
I mean, people getting colds, allergies.
Right. Same thing, can't smell, can't taste, runny nose. And once you get those, it's very important to get tested and get seen before things get worse.
Are the people that you're seeing, are they just riding off to, I just thought I had a cold, or are these people still denying that this virus is actually a problem?
Majority are denying. And then we have a few that had COVID before last year, and they feel they're still protected. But the science says after you get COVID, after probably a couple of months, your antibodies, it wanes off. And getting the vaccine actually boosts your immune system and gives you better protection. So we've had a couple of patients who had COVID before, didn't get vaccinated, and got the COVID second time, and they are very sick right now, requiring a lot of oxygen. So prior COVID does not mean don't get vaccinated.
Is Cox requiring their staff to get vaccinated since they're working hand in hand with these COVID patients?
Currently not.
Doctor, can you just speak to the morale among your peers, among the doctors, the staff, the respiratory therapists right now?
It's been very hard on us. After last year's wave, we had to work extra shifts and longer hours because we had to take care of COVID patients and the non-COVID patients. And at this point, we're very stretched thin. Like Ashley said, staffing is a big problem now. And going into the tower, into the new ICU, it's kind of taking a toll on us. And morale is high, but definitely some staff had a mental stress and challenges. It's been very challenging.
related questions as well, so we can have okay.
I do have a staffing
yes,
related, that,
yes.
so do you mind?
Celeste is gonna come up.
She's the one to get out, okay, good.
Thank you, Doctor.
Thank you.
Hello.
How is staffing?
I think staffing is tight at CoxHealth at the moment. In addition, we have to deal with additional patient volume right now. Even without a surge, staffing, the labor market's tight in the community, and I think across the nation, so we were experiencing that before we started the spike in patient volumes.
What do you need the most? Like, I mean, I know you need everything, but like, what are the most critical areas right now?
Typically for us, it's always been nurses. Right now, what we're experiencing includes respiratory therapists, surgical technologists to help deal with the backlog of individuals who delayed care during the initial surge. But really, it's also housekeeping, food services, everyone that helps support our patients, because increased patient volumes means more rooms to clean, more patients to feed. So really, across the board, we can use people from a clinical background as well as non-clinical.
Are any staff members having to work extra hours because staffing is tight right now when these travel nurses are not around?
Yes, we do have staff picking up extra shifts. In addition to people who are picking up extra shifts in their home departments, we also have an opportunity for staff to volunteer to help out in other areas. So for example, we have people in patient financial services who said, hey, on the weekends I want to come in and help in housekeeping. So we have over 200 people who have signed up to help in addition to their normal duties, which has really made a big difference. We also have a lot of people from the community reaching out, asking how they can help as well. So we're able to bring them on temporarily to help with some of the situations we need assistance with.
Are you all in the position to where you're providing incentives to employees at other facilities to take shifts in patient care?
Yes, so internally we do offer overtime, and there are some different critical staffing pay that we offer for certain areas that are of high need right now. We also offer referral bonuses for our employees who refer people to work in the system, and then sign-on bonuses to external people who are willing to come in and help.
Is the workload right now worse than it was in the winter as far as staff being tired, exhausted? What is the overall energy going on?
I think that they're more tired than the first surge, because I don't know that they necessarily expected it with the vaccination coming out that we would be in this situation again. And then, as Ashley alluded to earlier, we had plenty of time to prepare for the first surge, so we had enough travel staff here. With how quickly our volumes have increased, that's really created a strain with our ability to recruit travel labor right now. A lot of contract labor, they take time off in the summer, which is understandable, but that really puts us in a bind. And then just in general in healthcare in most places, you see turnover happen in May as people graduate. So August is our biggest hiring month. So here we are in July in a spike, right almost to our largest hiring month, traditionally.
If somebody were to come to you and say, hey, I'm a respiratory therapist, and they apply or whatever, what is the process like for them? How soon could you get them on the floor?
We can get people fully onboarded within a week. We don't want to compromise quality of care, so we want to make sure we do a background check, make sure that they're licensed. So we want to get that done, but we have a very fast turnaround time. We can actually do it in 5 business days. And then we can get them working on the floor. And then there is an onboarding and training process, so we don't just throw them in, but it's a pretty quick turnaround time.
If somebody is out there that watches this later and they have some condition that they can help with, what do you ask them to do?
They can call or text 417-269-JOBS, which is 269-5627, and we can find them a position.
I did have a question about vaccinations and employees. I didn't know they actually first. Okay, yeah. Is that possible? Thank you. What can you tell me about vaccination rates among the staff and employees here at the hospital?
It's about 62.5%, about 7,000 employees vaccinated. And since the vaccine rolled out, 0 of those have been admitted in the hospital with COVID pneumonia. That's a pretty strong case to get vaccinated.
have you seen more employees? Because I know there were some people who were delaying, who were waiting. Since you've had this other wave, have you had more employees say, okay, now it's time to get vaccinated?
Yes.
Thank you.
Do you have a breakdown of nurses and doctors, how many are vaccinated?
So I know that we have 92% of physicians are vaccinated. And basically what we've seen is the more education that our staff has, the higher their percentage of vaccination rate is for their group. So we have 92% with the physicians, and then some of our lower groups are closer to 40%.
Does it frustrate you guys that under 50% of our community is not vaccinated here in Greene County, and these cases are just rolling in one after another?
Yes, it's very frustrating. It's taking a toll on our staffing. We have about 45 employees out this week. So it affects our capacity, our staffing, and the mental health of our employees as well.
There was a question about morale earlier, and I think the fact that, in January there weren't other options for people other than just trying.
Do you mind doing it at the microphone? Start at
Sorry.
the beginning.
So I think one of the questions earlier was about morale, and I think one of the things that's different from January is in January the vaccinations were not widely available, and so staff were willing and happy to help keep the community safe by taking care of them. And I think it's a little harder now when the vaccine is widely available. So I think that's making the morale on staff lower than what it was this winter.
You think that's kind of a reaction? Because it seemed like, Steve Edwards would always say, there's light at the end of the tunnel, and everyone was real hopeful with the vaccines coming online, and so many in our community are just kind of refusing it. Is it a reaction for you all? Is that a reaction to the hope that you had, and now, maybe you're kind of getting slapped around by the community?
Yeah, I think we had hoped that vaccination rates would be higher, that we would not see a big spike in hospitalizations again. And so it is challenging knowing that there is an answer out there with the vaccine. It's hard on morale, it's hard on staff when we're asking them to work extra.
You probably had an optimism a couple of months ago when the shots were kicking in and more people were getting vaccinated. So looking forward, you probably had an optimism. What do you have now as you look forward? What's the collective thought, or what are you guys thinking, or what are you hoping?
I think we still hope that people will continue to be vaccinated. When they see this surge in hospitalizations, I hope that that is something that incentivizes them and makes them more open to getting vaccinated now. We're seeing on average about 85 people a day get vaccinated. Obviously, in our peak with our mass vaccination clinics, there were days we were doing 3,000 vaccinations in a day. So it's dropped off a lot, but we'll just keep ticking away at it and hope that those numbers will go up a little higher, that we'll start to see vaccinations, get back up into the hundreds and thousands.
And those numbers, that's Cox system, right?
That's Cox as a system, yes. So Cox as a system is vaccinating about 85 a day at the moment.
And I guess I have one other question. A lot of people aren't getting their shots. One, they just don't want to, and two, some people are hearing things. They're hearing things about side effects and this and that. Are there myths, or are there things that we can lean on as far as knowing the safety of these?
I think all the 3 vaccines we have now are very safe. We haven't had any admissions from vaccine side effects. They have mild symptoms, body aches, fever, but those go away in a couple of days. So, and the vaccine does not enter your DNA. It won't change your DNA. It won't change your outward appearance. And the vaccine does not cause COVID-19. I think that's one of the biggest myths, that you get a vaccine, you're going to get sick with COVID. It does not. And all 3 vaccines are safe.
And one of the reasons we know that is more than 300 million doses just in our country have been administered.
Correct. Well, yeah, 324 million doses in the country.
Are there any other questions?
Thank you.
Thank you all.
Thank you.
Can I take a picture of your name? I just want to make sure I have it spelled about Springfield.
I'm gonna do the same.
We appreciate your time. Thank you so much.